This is my philosophy of nursing assignment by Justin Schroll in Nursing 441. The three pillars of my nursing philosophy are to lead by example, be open to improvement, and to communicate. What I mean by these three is if you want to be a leader, you must first be willing to do anything you would ask of a coworker or of a patient. For instance, if you're asking a patient to willingly subject themselves to pain to increase patient outcomes, you must first explain benefits, show compassion, and also some empathy, in terms of something you would do for yourself in the same situation. In this same way, leading fellow nurses by working when you are short-staffed or if census is high demonstrates a positive attitude, or you should demonstrate a positive attitude or outlook and give your full job or give your job your full effort. Next is to be open to improvement. With evidence-based practice, something believed to be the best may be obsolete in the eyes of current research. Always be looking out for new findings and ways of improving patient outcomes. Finally, to communicate. Everything in our profession revolves around appropriate communication. Being able to delegate, voice when you need help, offer help when you have time, or just small talk with a patient. Um, the latter might actually reveal something a bit more pertinent to their care than revealed originally to the doctor. Communication is one of the cornerstones on which trusting relationships are formed and can reveal shortcomings in knowledge or a surplus of such, and should be shared appropriately. Caritas, caring, is something I definitely see every day in this profession. However, the most recent story I have comes from a medical patient that I was taking care of a couple weeks ago with an NG tube that was placed because of a paralyzed ileus after one of her after a surgery. She was new to the town I work in, rather, and her family was about 3 states away. She had no visitors for those first 2 days, and just started, a new job about a week prior to the procedure. Finally, on the second day, one of her coworkers, knowing very little about her, came in and just sat with her for a couple hours, just talk with her and have, some small talk just to be a normal human again. This simple non-medical interaction provided a change to the woman's outlook, lightened her mood, improved her pain, anxiety, and despondency. Mind, body, and spirit, and the awareness of the whole being's wants, needs, and feelings can have an enormous effect on the outcome for the patient. Being able to provide for time for a patient's reflection, meditation, or prayer can help put the spirit at ease in a confined quarter. Providing time for rest, even in the middle of the day, if at all possible, can allow the mind to rejuvenate and the body to heal. We care for the body as we, have been trained to do as nurses, and without it, we have no connection to the physical world. Lastly, converse with the patient and engage their mind. Help them understand what you are doing, what they are doing, and what goals we want them to reach. Of the environmental theory, some of the 10 still resonate with me today. Light and noise being the first one. Making sure there is enough light to properly assess a patient and making sure there's an absence of light and noise when the patient is trying to rest helps to aid in recovery time. Personal cleanliness, thinking specifically of contact isolation rooms, being able to provide patient care for a sick patient while keeping one's clothes and body clean provides the ability to care for another patient that might be sick as well. And lastly, food, noting how important diet is to recovery, proper balance of protein for healing, sugars for energy, or lack thereof to control, diabetes, or just knowing what is entering our bodies and being able to understand what the food or drink is important as a life, saving surgery in the first place. Moving on to Virginia Henderson's theory, many are still relevant today. She was one of the most important nurses of the 20th century, and her theory still pretty well holds up today. Many of the 14 points are very relevant. A few changes I would make, however, are to, I believe, her 13th rule, which is continuing education and evidence-based practice should replace learn, discover, or satisfy the curiosity that leads to normal development and health and use the available health facilities. Other than that, I thought her theory would also do well in adding a pain control point, since that's become such an important factor in both patient outcomes and patient satisfactory scores in the 21st century of nursing. Moving on to Watson, Gene Watson's philosophy has practical applications of love and understanding a patient's belief system and morality when providing care. For example, Muslim men not wanting a man in the room to take care of his wife, or understanding how certain faiths would prefer not to receive blood products or organ transplants necessarily. As for my personal caring moment, as recently as today, even I did pray with a patient as a spiritual person of no organized religion, belonging to no religion, purely to put a woman's mind at ease and to help her feel better. I didn't fake my prayer or its intent in the meaning, and the prayer itself was directed at whichever God she believes in. But the main reason for it was to provide solace in a patient's, time of need. Um, and it's the least we can do as nurses to help the patient feel more comfortable or at home in, foreign surroundings. And then as for a theory that connects my practice or my theory to my practice, I chose Imogene King's interacting systems framework and the theory of goal attainment. My three pillars of nursing philosophy, to come back to them again, were to lead by example, be open to improvement, and to communicate. Um, and then ways to reach the first goal at least. In King's words, if goals are attained, effective nursing will occur. It's a bit of a stretch to equate that to lead by example. However, Miss King's words show that if I show accomplishment of my goals for my patient, good outcomes for that patient and my fellow coworkers will occur. Be open to improvement. If transactions are made in the nurse-client interaction, growth and development will be enhanced. What I believe by this statement is Ms. King meant as a two-way street. Patients can tell us if we are incorrectly caring for them, or what we can do to better serve them. In the same sense, we can identify with a patient and be able to lead them to improved patient outcomes. Lastly, communicate. If the nurse and client make transactions, goals will be attained, in the words of Ms. King. Uh, this indicates that the nurse should be hands-on with the patient, both in care and in communication, by properly informing the patient of what is going on and why the patient can better understand why the nurse setting goals and for a patient to meet on that day.